You're listening to Brunch with me, Noreen Mayer, on this Wednesday morning. And since it's Women's Day, we're talking about women's health on this Wednesday morning. And so let's turn to the next part of today's program. In the next 15 minutes or so, we're talking about uterine fibroids with Dr. Ellen Lui, who's a specialist in obstetrics and gynecology and also an honorary clinical assistant professor at the University of Hong Kong. Welcome back on the program, Ellen. Thank you so much, Dr. Lui, for joining us this morning.
Yes. Good morning, everyone.
It's great to have you back. So let's perhaps talk about uterine fibroids. For some of our listeners who may not be so familiar, how would you describe it? What is it exactly?
So it is actually the commonest gynae cancer, gynae tumor that happen in the woman genital tract. And it is actually a smooth muscle cell tumor. And the good thing about it, it is benign. So, but then we are talking about the incidence of having a uterine fibroids is up to 20 to 30%. When people are getting older, actually the chance will further increase. If the woman is in her 40s, we are talking about around 1 in 2 to 3 women would have a chance of having a uterine fibroid.
So it's a growth that happens in the womb, and how is it different from a cyst? Because sometimes we hear fibroids, cysts. How are they different?
So fibroids, they are actually muscle tumors. So they are solid tumor. As compared to a cyst, it consists of water. And most of the time, the cysts happen in the ovaries rather than in the womb. And for fibroids, it happens in the muscle layer of the womb.
So what causes these uterine fibroids?
The problem is we now don't have a very clear idea of what is actually causing it. But we do see some people, they are more prone to it due to some different ethnicity. So actually the African American, they have got a higher chance of having a uterine fibroids. Chinese probably somewhere in the middle. If you're Caucasian, most of the time the chance is lowest as compared to other ethnicity. And we also know that age is also another risk factor for having fibroids. When people are getting older, the chance of having a fibroid will be increasing. And until after your menopause, then it won't further increase the chance, and actually sometimes the size of the fibroids may shrink afterwards.
After the menopause?
After menopause.
Very interesting. Wow. And is it hereditary? I mean, if your mum had it, are you more prone to it?
Oh, yes. We do see some like familial patterns. If you have got some family history with fibroids, your chance of having fibroids would be increased as well.
Okay, so we don't know the exact causes of them, but we do know that perhaps ethnicity plays a role, and also just it could be hereditary.
Hereditary and also hormonal sensitive, and that is the reason why we can see age would be one of the factor, because when you're getting older, actually you are being sort of more stimulated by more hormones.
Yes.
And also the other thing is if you don't have any babies as well, because you also have longer duration being sensitized by the hormones, and your chance of having fibroids will be increased as well.
Oh, that's interesting. And what are some of the symptoms? Is it painful, or is it different for everybody? What are some of the symptoms that you've come across?
Okay, so actually pain is not one of the common symptoms of uterine fibroids, but the symptoms of the fibroids, it quite depends on the size and also the location of the fibroids. Because if it is inside the uterine cavity where you have babies, where your period comes, and then it will most of the time affect your period. You may have heavy period. Some people may have heavy bleeding to the extent they may need to have a blood transfusion as well.
That's really serious.
Yes.
Wow.
And
how much are we talking about? Like for a long period of time, for 2 weeks, or each time is very heavy flow?
So they are talking about each menstruations. I have got women, they need to change their pads every hour.
Wow.
They need to use both tampons and thick pads together, but it can still soak through.
Wow, that's a very heavy bleeding indeed.
Yes.
Wow, okay. Yeah, that's very serious. Yeah, and very disrupting and debilitating. You can't really...
So you can't really go to work, or sometimes you may need to just go to hospital quite frequently just for the bleeding
blood transfusion. Exactly.
Yeah.
Wow. And so that's one of the symptoms, heavy bleeding. And you mentioned the size and the location. So what are some of the sizes that it can come in?
So the size can range quite a lot. So we are talking about it can be less than 1 centimeters and up to even more than 10 centimeters. But most of the time, size is not really the factor alone that for us to consider when you need to go for treatment. Because for a very small fibroid, if it is inside the womb, and we'll call it inside the cavity of the womb, then it may affect the bleeding, it may affect your chance of having babies. Then you may need to go for surgery even when it is really small. But then for a very huge one, if it is, we'll call it the outside the womb, or in that case, most of the time the symptoms is more subtle. And some people may only have some compression effect at very, very late stage. We're talking about it may compress on your bladder. You may need to go to toilets very frequently, but that only happen when the fibroid is really huge. We are talking about sometimes you maybe feel like a 4 to 5 months pregnant before you feel any symptom at all.
Wow. And how big do these fibroids grow into the size?
So actually it can be very, very horrendous. Talking about the biggest size I've seen is more than 3 kilo, the size of the fibroids.
Whoa, 3 kilos. That's actually very heavy to carry around.
More a baby size, like I would say.
Exactly. Yeah, it is sort of like the baby when it's a newborn.
Yeah,
you know?
newborn baby.
Wow, that's very big. But that's sometimes it can be affecting the bladder and the control of that as well. But you mentioned a good point, Dr. Lui, that sometimes it isn't the size of it. Sometimes it can be very small, but affecting fertility or affecting pregnancy, that it can be an issue. So before we talk about some of the treatments, so it's not cancerous, these fibroids, or can it sometimes develop into cancer?
The chance is actually very small. We are talking only about 0.2 to 0.3%. So most of the time we will regard it as a benign tumor.
Okay, that's kind of good news. So what are some of the treatments? Is there any medication that you can take for these fibroids?
The problem with fibroids is we don't have any good drugs. We only have drugs actually maybe to control the bleeding, for example. Maybe the symptoms control rather than for the fibroid to shrink the size. And we don't have any good drugs in order just to treat the fibroids. So most of the time people need to go for some sort of more invasive procedure to treat it. We are talking about traditionally people will go for surgery to remove it,
Can you do a keyhole surgery in that body part? Okay.
Yeah. So, but it depends on the size of the fibroids. If it is really too huge, like the 3 kilo one, there's no chance that we can go for a keyhole surgery to remove it.
You're right.
And also, we do have an option we call a hysteroscopic myomectomy. That means we put in an endoscope inside the womb and to remove the fibroids. Yes, okay. But it depends at the end, like the size of it and also the location of it. And the good thing about the endoscopic surgery is actually you have no scar on your tummy at all. And you do have a quick, very, very quick recovery afterwards.
Okay. Yeah. And in terms of do people have multiple fibroids growing that you've come across, or is it in just one area?
Most of the time it is in terms of multiple fibroids. Yeah.
Okay. And do they reoccur even after removal?
Yeah. So the chance of reoccurrence is quite high. We are talking about around 3 in 10 women. They may need to go for another treatment for the fibroids in 10 years' time.
Okay. Wow. That's actually quite soon in terms of... and do they tend to grow in the same places, or does it vary around the cavity or outside?
It varies around because actually the whole womb, they are considered of like smooth muscles, and then so everywhere in the womb can happen.
Have you come across some severe cases, Dr. Lui, that some women choose to remove the womb or the uterus entirely to prevent it from reoccurring?
Yes, especially for those women probably in their 40s, they have completed their families and they don't want a chance that the fibroids to come back again. And they would prefer to go for just surgery to remove the whole womb. in order to just get rid of this.
Yeah, for it not to reoccur. But then does that mean then they have to go on, say, hormone therapy or other hormone replacement in order, because it kicks in menopause, does it not?
So after you remove the womb, actually you don't have more menstruation afterwards. But it doesn't mean that you will be in your menopause, because uterus and the ovaries, they are separate organs. So we can remove the uterus, but we can keep the ovaries so to keep the hormones.
Okay. Oh, that makes sense. So then in that case, then removing the womb, you won't be kickstarted into a menopause because the ovaries are still there.
Yes, and that is also what we recommend, because we do know that women need actually the hormones for their bone, for their heart, and for their the overall health. So usually we will recommend just remove the womb and keep the ovaries for the hormones until natural menopause that kick in.
Yeah, we are live, by the way, on Facebook. You'll be able to see and hear Dr. Ellen Lui on Facebook, Noreen Mayer on RTHK Radio 3. So we talked about sort of the removal of the womb, but how about for some people who are needing it to get pregnant? How might uterine fibroids affect pregnancy or fertility?
Okay, so we do see that actually if women have a fibroids, and especially for those inside the cavity, then it's sort of as a more space-occupying lesions. So it occupies part of the cavity that is where the baby should be staying, and it will affect the implantation of the embryos. It affects the baby growth as well. And if you sometimes you do have a big fibroids, we do see you have a higher chance of preterm labors. The babies may not be in a head-down position, so you can't go for a natural birth as well. So these are the complications of fibroids affecting your fertility.
And in terms of, sorry, pardon me, I'm about to cough. Pardon me, Dr. Lui. In terms of finding out these fibroids once you're pregnant, are you able to remove it once you're pregnant?
So unfortunately, no. If you are pregnant, we can't do anything at all, because all the surgeries, even all the non-invasive procedures for the fibroids, they are not suitable for pregnant women. So we can just only observe it. And that is the reason why we do advise women to have regular checkup. If they do have fibroids identified before they are pregnant or while they are trying to get pregnant, they may need to consider going for treatment for it before they try for a baby.
Yeah, that makes sense. And also, once you have your baby, then you can remove the fibroids.
Yes.
Okay.
Yes. Or we sometimes remove the fibroids before you have your baby.
Yes, that would be the much better way around. Yeah. Have you seen instances where people get pregnant or in the cusp of getting pregnant and then not able to carry the baby because of these fibroids?
Yes.
Okay, so that does happen. It's quite common. It's a common cause of infertility.
It is not
one of the
cause of infertility.
Yeah.
Okay. Or one of the cause of miscarriage.
Oh, yeah. And it can cause miscarriages.
Yes,
also.
It can cause miscarriages as well.
Okay. And in terms of treatment after that, so surgery is the only really effective treatment. Can you talk us through the procedure of it?
Yeah. So. Talking about the surgeries itself, what we want to do is actually to remove the fibroids or to restore the cavity, to make the cavity normal again. So the easiest way is actually to go for the endoscopic one. Endoscopic one, we put in a camera in, just like people going for a colonoscopy or OGD. And we put a camera in, and then with the camera, we have got a small knife attached to it, and we can cut the fibroid out. And as compared to other traditional one, we can go for keyhole surgeries or even an open surgery to remove the fibroids.
Excellent.
Yeah, but nowadays we do have other options which is less invasive as compared to surgeries. So have you heard of people doing for HIFU?
Oh, I have heard of HIFU,
yes,
but usually
that is
that's
for
a
the face.
facial.
Yes. But now this technology can also be used on fibroids.
So that's the high frequency,
high intensity focused ultrasound.
Okay.
Yes. So what we are going to do is they have got a big machine they put over your tummies, and with the high intensity focused ultrasound, they want to focus the ultrasound energy onto the fibroids. and it will cause some increase of the temperature, so sort of more burning effect on the fibroids, and hopefully it will shrink the fibroid afterwards.
Wow, that's
Yes.
really cool, this technology. Because we normally hear HIFU with, facials.
Facials
Yes.
or
Yeah.
for the body shaping thing.
Yeah, exactly,
Yes.
for body shape, but it's
Yeah.
instances where it can be effective on depending on the size of the
Yes.
uterine fibroids.
Yeah, so these are the other more newer options or
Less
non-invasive, less invasive options for treating of fibroids.
Wow.
Yeah.
Dr. Lui, as usual, I really enjoyed talking with you this morning, and thank you so much for taking the time sharing this on Women's Day especially. So I really think all the women listeners, and also male, if you've got some a loved one, your sister, your wife, your girlfriend, your mum, it's a good chance for them to get body checkups. And how would they, is it through a scan, or how would you know that you've got
Fibroids.
Fibroids, yeah.
So just a very, very common gynae scan, then we can find a fibroids. It's just a usual ultrasound scan. The good thing about it is it didn't have any radiation at all, and then it's a simple and quick procedure.
Yes, so
Yeah.
we should all take this opportunity to go for some body checks and check for any fibroids or any cysts going on. Meanwhile, thank you so much to Dr. Ellen Lui for joining us this morning. Dr. Ellen Lui is a specialist in obstetrics and gynecology. Thank you so much for your time today.